I'm going to turn it on now. Yes.
I thought you said it should be a football shape.
Well, what'd you get? A hot dog?
Pasta.
Some kind of, oh yeah, it looks like tagliatelle. All right, I will mark that down. Okay, so. Let's look at the one, voice health and hygiene study questions. Okay, and we'll just, bless you. Oh, delicate. My goodness. So you guys have like moved to practice. What's up with that?
I needed a plug.
Did I not remind you guys what to do?
Yeah, we didn't solve. Honestly.
Okay, so let's get out the one, voice health and hygiene. Okay, question number 1. Name the disorder, and just raise your hands, okay? Name the disorder whose symptoms include breathy mid-voice, cracking on high notes, hoarseness, bless you, lack of endurance and intensity, and inability to sing softly.
What is?
Count.
No.
That would be certainly nodules, which are less common than we probably thought they were years ago, but we were able to distinguish between nodules and polyps and things a whole lot better. The cameras on the scopes are better.
Wait, nodules are less common than we
They
thought?
are less common than we thought, yeah. So the mid-voice is breathy because the vocal folds, you've got, you know, a bump on one side and probably a reactive mass on the other side. So their vocal folds can't contact this way. You're getting this kind of a thing happening. Okay, so there's breathiness, okay? Cracking on the high notes. Well, if you've got a stiff area on the very edge of the vocal fold, then it's harder for your muscles to stretch that long, okay? And it's going to vibrate a little erratically because you've got this area that's stiffer that doesn't have the same mucosal wave, okay? Cracking on the high notes, hoarseness, lack of endurance and intensity because it's breathier, inability to sing softly because what oftentimes happens is the person, since they have this thing there, then they press because they want to get it clear sounding like normal, okay? But then the minute they take off some of that extra effort, then you get the breathy thing, okay? And their voice is kind of cutting out, okay? So all of those things together, those are some of those questions and tests that a laryngologist is going to use to kind of narrow down, okay, we have something on the edge of the vocal fold here that's preventing things from happening normally. Okay.
Are notes common in non-singers?
People who have kind of a pressed sound, who speak with a pressed voice, they are also likely to have another kind of voice disorder, which
So
we'll get
it's
to.
not overuse, it's inappropriate use.
Yeah,
Kind of both.
it is some of both.
Okay.
It's over and inappropriate.
I thought it was more over though.
Not
Maybe
necessarily.
Maybe that's for singers.
Not necessarily, but interestingly enough, nodules are much more common in women than in men,
Yeah.
and in pre-puberty age boys. Now, pre-puberty age boys just make all sorts of crazy noises, and they use their voices constantly. But what's similar about a female speaking voice and singing voice and a boy before puberty? Range. Higher frequency voices tend to have, there's a higher preponderance of them having nodules than low voices. And so there is a frequency of vibration component there.
Is there an age that's more common in women?
I don't know.
No.
Okay. The other name for contact ulcers of the arytenoid cartilage is someone who did not stick up their hand first. The other name for contact ulcers of the arytenoid.
I don't know how to say it.
Granuloma.
Okay.
Very good. That's right. Granuloma. That's the more Dr. Hoity-toity for it. Yes. Okay, number 3. this condition can be brought about by seeing too much intensity in the mid-range, especially in females. Okay, so if you're in your mid-range and you're pressing, what might you get? Which are nodules. So pressing for more sound in your mid-range. Yeah. Okay, number 4. This disorder's symptoms include hoarseness, well, we've seen that before, a breathy sound, well, we've seen that before, and a sensation of needing to clear the throat. Disorder is the result of a vocal fold hemorrhage. Polyp, which is basically a blister kind of thing. Fluid-filled, more blister-like. Yes, ma'am?
But if you press, can you get past that breathy sound?
Well, and that's exactly what people do. That's
So
exactly
then you
what,
think that your voice is fine because it sounds
but
normal.
you can't
to
sing
Doing it
soft,
right now.
can you?
Wait, what?
See, but that inability to sing softly is one of the real hallmarks of,
Yelling.
there's something on the margin that's,
Wait, what was your question?
yeah.
I asked, because it says a breathy sound, I said, but if you're pressing, then you can achieve the sound that you would normally, like that you're wanting, like that.
Yeah.
But
Is
it's,
it gonna be painful or?
but it's gonna exacerbate your problem.
But would you feel anything?
You would probably feel fatigue and more effort,
I have.
more effort to phonate,
This password.
less endurance, yeah, okay. Number 5. The treatment for the vast majority of vocal nodules includes a carefully monitored program of
Speech therapy.
speech therapy. Okay. Yeah, and in fact, laryngologists hardly ever do any kind of surgical intervention on nodules. Because what's the point? If you don't fix the behavior, you're gonna be right back where you are.
No, I'm glad I went to speech therapy.
Speech therapy is certainly recommended for practically everything here. This disorder is frequently caused by a single traumatic event, like yelling at a ball game or severe coughing. Someone in this row.
It's called, when it bursts, it's,
Yeah,
I can't think of it.
look at number 4.
Look at.
Oh.
A hemorrhage.
Yes, a single traumatic event. Severe coughing. I've even seen it in somebody who sneezed, was holding back the sneeze. I think I mentioned about that.
Yeah.
You remember seeing Jill Green's
It wasn't
vocal
that bad.
folds when she hemorrhaged?
How did she get that? She said she was holding back the sneeze, right?
I forget what it was, coughing or sneezing, yeah, one of the two. Often called corns of the folds, these thick bumps prevent the folds from closing completely or stretching efficiently. Which are nodules.
Everything
Yeah.
is not.
Everything is.
Well,
But the first thing we said was that they're less common than we originally
They
thought.
are.
But they're everything.
But
okay.
they're the easy, but I think they're the easiest thing to get, right?
They're a cause of long-term habits rather than a short-term trauma.
Why is it called corns in the hole?
Well, that's not used very much anymore. But if you just remember this, you know, you get a blister by, you know, like working in the yard with a rake, and in 30 minutes you're going, oh my gosh, geez, you know, but you get a callus over a long period of time, right? Because that's your body's response. You build up more skin cells, which is epithelial cells, because there's friction, okay? So think of a nodule as very much like it's a callus. It's a result of contact and friction. Yes, ma'am?
So the nodes can be corrected.
Yeah.
Is there damage to the fold after a node is corrected?
Resolved. If you've had therapy and you've had, you know,
Like, does it
complete
leave behind a
resolution?
scar?
No.
Have you ever had a callus?
Yeah, I mean,
Like, I used to have a horrible callus on my thumb from playing flute.
yeah,
And I honestly thought it was never gonna go away.
and it did.
But when I stopped playing flute,
It
it's,
went away.
it's normal.
Or ballerinas,
That's right.
their toenails
Yeah.
grow really thick,
You get
but
these-
when they stop dancing,
That's
their
right.
toenails are normal.
That's right. That's
So like after
absolutely
their
right.
career, their toenails are
Okay.
normal.
So, reducing the vocal load, reducing the vocal load so that you're not using your voice quite as much, learning better habits, letting things heal, there's no reason. I mean, I could name off professional singers who've had nodules, you know, from. Pavarotti did as a young singer. Yes, he did. As a young singer, before he became Glorioso. By the way, I should play you, next semester I'll play it. I have a recording of him, his operatic debut, when he's 20 singing Che Gelli da Manina, and it is, that's just not fair. Do you guys have choir at 12?
No, but we have choral lit.
Yeah.
Oh, okay, he moved it up. Okay, very
When is
quickly.
the review Friday?
We're gonna have a
11.
review on Friday at 11, right here.
Will you post it on Blackboard?
Yes, I will.
Okay.
This condition is caused sometimes by acid reflux or surgical intubation.
Oh.
Is it inflammation?
Is it
Or like,
intubation, is that what you said?
no, is it inflammation?
It is, yeah.
So I have granuloma?
Yes, yeah, it's granuloma, because if you've had the tube there, for a long time, like somebody's been in a hospital and they've been on a respirator for a while, sometimes, or a long surgery or something like that.
That terrifies me.
Yeah, and acid reflux is another common cause for the granuloma.
Like if you pass out and they like put a tube in your foot or something. I know like they've like missed it,
Well,
and people have had injuries from that.
Yeah, dislocated arytenoids and things like that, yeah. But you have to realize, their job is to save your life.
Oh, yeah.
Their job is to save your life. If it's elective surgery, talk to your anesthesiologist. I mean, I told you guys the story of my wife having to have after the C-section, and they're like, Mr. Nixon, you go. And I saw the anesthesiologist, and I said, can you make sure that you use a pediatric tube and you up your oxygen ratio? And he's looking at me like, how do you know this? And I said, she's a professional singer. And he's like, okay, all right, you know, and boom, I'm out the door. And then he was the one who came and saw me, you know, and he was like, I didn't need to intubate her at all. I just upped the epidural in her back and she snored through the whole thing. So, you know. But anyway, you wanna talk to your anesthesiologist, big time. How many people have choral lit? Like most of the room. Okay. Bummer. Okay. Did you go through the other sheet? The other review thing? Because that really is detailing, you know, if you can go through those kind of things, like take yourself, you know, and whoever comes on Friday will go through this other sheet. This is really good in terms of the voice disorders. I have not made up the test because I'm gonna have to redo it, for a variety of reasons. Not you guys, mostly on me. But on Friday, we'll work through that. At 11 o'clock, here. Be here aloha. I may bring snacks.
Then I'll
Made
check.
by- Yes. What kind of snacks are you wanting? You have that.
Healthy,
You
something
have that.
healthy.
No, I don't have the answers written in.
No, noon. They're doing like.
I'm sure Dr. Wilson is
I'll do it with
Now, I know, everybody's sitting here, if you start self-diagnosing, you know, it's when things are consistently that way, you know, it's like, this is not normal, and suddenly I'm noticing this, you know.
How long is consistent?
Well, I would say if there's been a change and it hasn't gotten better in 10 days to 2 weeks,
Okay.
you know, but if it's like a couple of days, you know, that's when you have to start thinking, okay, how's my sleep been? How's my diet been? You know, are there other factors that could be wigging my voice out? Am I on different medication that might have some side effects that I wasn't thinking of, you know? But if, you know, 10 days or so, it's like, no, that's not getting back to normal, then that's when you start asking some questions, you
What
know.
if it gets back to normal like right after 2 weeks or something?
Okay.
Then you're fine.
Yeah, and in the meantime, you know, what are things you can do? Well, caution is a good policy, so like if you have some big choral thing that you're gonna be singing for 2 hours, you know, or sing sparingly.
Yeah.
You wanna not sing a ton in any one day, and you wanna break it up into small little bits.
Yeah.
You know, you might say, okay, I'm not gonna sing that really high, loud thing today, I'll work on recitatives or something like that. You can still get practice in without it being quite as athletic, you know?
Mhm.
Yeah, I mean, like, I've had a cold, and I was able to sing, a little bit on Monday. I sang for like 10 minutes, and yesterday I practiced maybe 20 or so, and it was like, we're done. And then today, it's more down in my chest a little bit, and I've coughed a little bit, and I sang for 10 minutes this morning, just did like lip bubbles and sighs, and just breathe, you know, just things like that. And it's like 10 minutes is like, okay, I'm done, you know? Because it's just, there's no point. Why? I don't have to sing a jury, you know, and I don't have a gig in the immediate offing, so why take a risk, you know?
Yeah.
I'm gonna just take it easy for a few more days, and gradually my voice will heal, so. Those are the things you can do. I mean, I've been talking to a former student of mine who, she went and saw Dr. Bergeron, you know, and she has some concerns, and Dr. Bergeron did an exam on her and said, you know, it's not so bad, you know, you have this little issue, and I'm gonna talk to Dr. Bergeron here in a few minutes, but, you know, but the student was saying, so what do I do, what do I do? And I said, well, lower your vocal load. She's a public school teacher, and I said, so use your amplifier, which I know she has one, and do more dialogue, interactive things rather than you talking. And if you have any big gigs coming up with your church, find a sub, you know, so that you're not on pressure, you know, to have to perform. And gentle singing, you know, would probably be better than complete rest. You know, just gentle bubbles and sighs and slides and, you know, humming, things like that. Give yourself a chance to heal, you know. And she has the Christmas break where she won't be teaching for 2 weeks, and that'll be a wonderful time
Yeah.
to just kind of chill and let her voice recover. So, and then I'll talk with Dr. Bergeron and, you know, figure out what she would like me to do with this person in terms of, you know, returning to more singing, and how soon.
I
So,
think you have the coolest job. You like work with people like.
I get to teach you guys, that's the cool part.
Yeah.
If I, you know, I've worked on books, and I've written articles and done experiments, you know, all I wanna do is teach ped classes and teach singers, that's all I wanna do. If I never wrote another article, or worked on another book, or spoke at another conference in my life, I would be okay, as long as I could teach ped and teach singing.
Mm-hmm. Yeah.
And I mean, I enjoy working with people who are kind of coming back from a difficulty, but I wouldn't want to do that all the time.
No, yeah.
And I mean, I do that kind of
Is that really
on the
hard?
side.
I know there's someone in Houston who does that.
Yeah,
all the
Sharon
time.
Radionoff, yeah, and Sharon's been doing that for, gosh, 30 years.
But
Yeah.
you're kind of the person in San Antonio, right?
It seems that way. I mean, I didn't mean to be, but I kind of,
Well,
it's
your
turned out that way.
relationship
With Dr. Simpson and Dr.
Simpson.
Bergeron and with the guys at BAMC as well. But some of that is because of my background, you know. I mean, I haven't just gotten performance degrees, but I have some of this other coursework as well. So it is a line of work for people interested in teaching. If I were in school now, I would probably be seeking out something where I learned more about, if I was gonna do that,
Yeah.
you know, as my full-time thing. The best people that are doing that have masters in voice performance and a master's in speech pathology. pathology. So like my friend Lita Scarce, who is at Duke Medical, I mean, she has a master's from Indiana. She was singing leading roles at Indiana. She sang with opera companies. And so as a soprano, very fine singer. She also has master's in speech pathology, and so she works as a singing voice specialist and as a speech pathologist. Wendy LeBorn is the same way. Wendy has double masters, voice performance and speech pathology. She has a PhD in voice science. And she's at, well, she works at Cincinnati Conservatory. She works at 2 different voice clinics, one in Dayton and one in Cleveland. You know, there's some really, really good people out there who have the dual background. And if you're gonna work with professional singers in a clinic, that is, you need to have those 2 degrees. Because you can't see people in a medical setting without a medical degree. So, and I mean, a clinical background degree. And so the speech pathologists, they get a master's degree and then they do 1,000 hours of, it's their internship stuff. Well, that's the clinical fellowship, is the 1,000 hours, I think. But anyway, there's a ASHA, which is the American Speech and Hearing Association, oversees their licensure. Well, accredits the degree programs and offers the clinical competency certificate, and then the states are the ones that do the licensing. It's very, very complicated.
Yeah. I
But
told my brother if he goes into laryngology, I would get a degree in speech therapy. And I was like, then we could work together,
you
be
could
the
be
light
partners.
line. And he was like, yeah, but mom's already offered me her office to be a light line in Sun. And he was like, I don't want to do that either.
So your mom is a otologist?
Mm,
No,
she's ophthalmologist.
She's ophthalmologist, yeah.
He's like, I don't get it. You people need to learn. I want to live my own life.
That's almost 42 days.
What?
Of internship.
Well, yeah, there are all these clinical hours that they have to, observing and then
Yeah.
basically mentored working in a clinical setting. Yeah, I think the clinical, well, there's the clinical fellowship year, which is another thing that people sometimes do. Anyway, I'm not one of those, but I know lots of people who are, and I mean, Jill is
Yeah.
obviously CCC SLP, and so is Janelle.
She sings too, right, Jill?
Not
Not really.
not as her big deal. I mean, she enough to be able to work with people in the clinic there if they need to do some basic kind of stuff. But as soon as if it's a singer, she puts them in touch with me either while they're finishing up therapy or after they've finished. And you know, sometimes I just see them a couple times. Sometimes I might see them over a period of months. It just depends. But it's great work, and met some really cool people, you know, worked with some really, you know, rock singers, jazz singers, and, you know.
Do you work on rock and jazz music with them?
Oh yeah, I work on the music they sing. So,
cool.
you know, Nakia, who is a blues rock singer,
Yeah.
I mean, that's how he was referred to me by them.
So if you have like a female belter, I mean, do you know how to teach that, or do you just know how to fix that?
No, I work on, yeah,
Interesting.
I've got a gospel singer that I'm working with right now, yeah.
Cool.
And, yeah, I've taught R&B singers, I've taught, belters.
But
yeah.
they've come in learning the style.
They've come in already singing the style,
Yeah.
and I'm working with them on how to do it in as most efficient
Yeah.
a way as possible.
But would you know how to teach that style? Like from the beginning? Okay.
Yeah.
Very interesting.
So like if I came in and I said, teach me how to be an R&B singer, student.
Well, I couldn't do the style stuff, but I could certainly help you with the vocal aspect of it.
Yeah.
I mean, and there would be a point where I would say, okay, you need to go see somebody who's a real style specialist, you know?
Yeah.
Maybe Christina did that.
But yeah, I mean, and Jordan Bryant, who did her master's here in performance and pedagogy, and she teaches at NISA, you know, she did her research project in her PED degree on belt.
Oh,
And
she still works, is she still in St. Philip?
I think so, she had a baby and stuff, but yeah,
Okay.
she's there.
That's good to know, cause I know a lot of the girls, like, in the shows I'm in, or like in my dance classes, they'll be like, well, who's a good voice teacher in town? And I'm like, well, I could name a ton of opera singers,
Yeah, but that's
but
not
I
what
don't
they
know
wanna
any
do.
belters, and that's not what
Yeah,
they wanna do.
Jordan's
But
really,
Jordan would be
Jordan's
good.
really specialized in doing
Okay.
that, yeah.
And somebody who the thing is, I think if you wanna go into that, you should work with somebody who knows how to sing classically, because I've worked with belting teachers who it's like, oh my god, this person doesn't know what they're talking about at all.
Yeah.
You know, and it's like, what am I doing here?
Well, ideally, you wanna find somebody who is versed in a variety of styles.
Yeah.
And, is comfortable. I mean, I grew up playing in rock bands and listening to rock songs, you
Yeah.
know? And just knowing how to help someone, have multiple choices, you know, okay, I hear you doing this, is that because that's the only way you've ever done it, or is there a particular effect you're after, you know, and
You have to ask a lot of questions.
you have to
since
ask a
you're
lot
not
of questions,
familiar with the
yeah,
stuff,
you know, or it's like, okay, I'm hearing you do this, let's have maybe some other choices, you know, so, okay, you can do that 2 times a night, and it's not gonna probably kill you. You could do this, or you could do this, or you could do this, you know, and then if you approach it from the standpoint of expressive, so what are you trying to get across with the text there?
Yeah.
And then helping them to find multiple ways to convey the emotion that they want to do, and helping them find ways that are less wearing.
Yeah.
Because most people don't like pain, and they're not real keen on high effort. And
Yeah.
so if you can help them find a way that gets a lot of the emotion and effect that they want with less cost,
Yeah.
they're gonna buy into that. And, I mean, I'm not afraid of somebody belting with high energy as long as it's free.
Yeah.
I don't wanna see somebody all physically tense. You get their breathing and their
Yeah.
body alignment and stuff, and, you know, their jaw as easy as possible, and the right vowels and stuff, and it's like, yeah.
Okay.
Yeah, I mean, my good friend Brian Gill, he teaches in Indiana, but he also keeps a studio in New York. He goes back like once a month. And I mean, he's got people on Broadway,
Yeah.
he's got people in rock bands, and he's got people singing at the Met, you know?
Mm.
So, and,
Wait, is he faculty at Indiana?
yeah, he's the
Okay.
lead pedagogy guy at Indiana. He and Brian Horn, the 2 Bryans, are at Indiana, yeah. And they're both really good voice teachers.
Okay.
Brian Horn is, Jamie Barton's teacher.
Oh.
Yeah.
Wow. I'll have to look into them, 'cause I'm looking at
Yeah,
grad schools now, and I like Indiana.
yeah,
My
yeah, it's
teacher in high
big,
school-
big time opera school.
Yeah.
Big time opera school. I mean, my student Lorenzo Garcia went there. Rebecca Howell, who won SOTI
Okay.
when you were a freshman,
Yeah.
she's up there now. She's studying with
Oh,
Carol
I
Vaness.
didn't know that. Okay.
Yeah, there's a couple of Baylor kids up there. Billy Bruley is up there
Yeah.
still.
Yeah, Will Hearn, my teacher in high school, went there.
Yeah.
But I know he's like, he did not have a good experience.
Really,
And he's like, I don't want you going there, but I'm like,
man, the guy has some serious hair. He's got that man mane of hair, right?
oh, yeah, he does. Oh my goodness, he just had a baby.
Oh, yeah, well, his wife had a baby.
Well, yeah, okay. Yeah, his wife, they had a baby together.
They,
Oh,
yeah, he's got a
I'm
nice,
gonna see his
he's got a
concert.
nice voice.
He really does. I'm gonna hear him on Sunday.